Thank you for introduction, Eddie. Hello, everyone. My name is Somang, and I'm going to present my internship experience under Professor Randall Blanco. And the title of my study is, sorry. Title of my study is Perinatal Study and Social Determinants with EHR. In today's agendas, I will speak four contents: quick introduction of the team and its goals, my work progress that I accomplished, an objective of my study, and the challenges I faced through the internship. The UNC Perinatal Research Service Center here at SC contributes to lowering the risk of pregnancy complications, and it focuses on clinical research. The setting of the center is multidisciplinary team members working on prenatal study, multiple prenatal study at the same time. We have weekly meetings to share the research ongoing and share feedback, also the thoughts. My research was on independent project that allowed me to get familiar with the data models to extract information from prenatal EHR data. This is the overview of the internship work progress. We do literature review about prenatal study about 4 different or related topics and select the database to extract the EHR and build the infographics to provide better understanding of the system. As shown in the PowerPoint, I'm currently in the middle between second and the last stage working with data visualization. In my case, I used I2B2 in NCDHHS database to extract the data and use Tableau for data visualization. I focused on EHR related topic because I really wanted to engage more on how EHR could affect public surveillance. Therefore, the objective of my study is EHR can be an indicator of health status that is critical for tracking maternal health concerns and triggering authority activities to prevent and control prenatal diseases and advance women care. The keywords that I use for the research is public health surveillance, electronic health records, challenges, solution, and the EHR's advancement, prenatal diseases, social determinants, and TPH. Before we dive into the study, I want to point out why maternal health is so important. It's because one, it's addressed a wide range of conditions and health behaviors that affect health, wellness, and quality of life of women. And comprehensive study of healthcare afford during pregnancy enables identification of existing health risk in women and an opportunity to prevent future health problems for women and their children. I picked postpartum hemorrhage among many other prenatal diseases because postpartum hemorrhage, PPH, is excessive bleeding following the birth of baby. About 1 to 5% of women have postpartum hemorrhage and is more likely with a cesarean birth. The frequency of severe PPH was 2.5%. After doing some research related to risk factors of PPH, I found years and years of research on those risk factors more related to biological and clinical factors. I realized not many papers performed on socioeconomic factors. Some studies might include race and ethnicity as potential factors to PPH rates. I believe social determinants of health are essential indicators that directly or indirectly impact the ability to manage medical condition and outcomes. Therefore, awareness of these kind of factors could lead to providing of greater safety to women. I brought some idea from the literature that age, race, geographic region, type of delivery, educational background could be also the cause of postpartum hemorrhage. There was couple literature focused on U.S. maternal mortality. The study compared maternal deaths, maternal mortality rate for non-Hispanic Black women was 3.55 times that for non-Hispanic white women. This accounted for 95% of the maternal mortality disparity. The graph on the right shows that the risk of severe morbidity disparity was significantly higher among Black women, which is 26.6%, than non-Hispanic white, Hispanic, or Asian women. Uh, it shows that there could be many cultural and racial bias when Black women get treated. So I wanted to narrow down to North Carolina and see the maternal mortality. However, it was so hard to find the public data set. So I changed to see the infant death among the race in hospital after the birth. According to the NC Division of Public Health Data, the infant death rate among Black baby in hospital has always higher than in other races within 2016 to 2020. Surprisingly, it was more significant than overall US Black baby death rate in US, which is 10.8%. For the conclusion, there are many factors cause PPH. There should be more understanding of social cultural effect when women having a labor or following the birth. Therefore, implementing EHR as a tool to regulate maternal health outcomes at the local, regional, and national level seems critical. It improves patient care, patient engagement, maybe care coordination. Patient outcomes could be high, effectively in cost saving. EHR has the potential to improve public health based on collaboration and integration. For the next approach, I'm going to extract the data from I2B2, which is a web application designed to improve the research experience that links to the Carolina Data Warehouse for Health. I will keep looking the maternal and maternal mortality between race first and other social determinants such as health insurance, education level, geographic variation to figure which social determinants affect the most in PPH and make it infographic based on those data. These are the references that I use for the research data. There were several challenges that I encountered during the internship literature review. It was so hard to keep on with the time first, but Professor Randall guided me how to formulating efficiently look the articles looking the bush, not the single tree. Formulating research question and objective. Although I have experience with research, but it was hard to formulate the research question in the field that I'm not familiar with. But I got help a lot from my friends in the team and also professor. Privacy restrictions. Since the data is related to patient, it requires lots of confirmation and restriction. Therefore, as my instructor recommended, I had to come up with Plan B, I2B2, which is contains UNC inpatient epic data. Delaying in activation in I2B2. After I got access to demo file, I had to work on modules and evaluation in order to get a full access. I waited for like 5 business days. I got permission to use it, but it kept getting error with no reason. Like a skill using Tableau. It was my first time using Tableau, therefore I didn't know the data will show as a sum data when I import the file. So I had to work on granularity. That's all I have for you, and thank you for the attention, and I'm happy to take the questions.